Judith John was a seasoned professional working in the hospital and healthcare sector who thought she could handle any crisis that came her way. Then she learned she had an inoperable brain tumor, and suddenly she became the patient, not the provider. It gave her a window onto how awful it can sometimes be on the receiving end of Ontario's healthcare system. Judith John has since become an advocate for patients, and she joins us now. It's nice to see you.
It's very good to be here.
It's nice to see you upright and healthy, I should add.
And without a patch over one eye.
I do recall those days,
yes,
indeed. How long ago was it that you discovered?
I was discovered in 2001.
That you had an inoperable brain tumor.
And they tried operating. They did a first surgery through my nose, which was transsphenoidal. And I was told at the end of that it was relatively successful, but a small particle was still in my brain wall.
How did they find out in the first place that you had it?
It was incidental and accidental. They were actually giving me a CT scan for something completely different, a little bit of cancer that I had. And this was a good accident, because had they not found the tumor, I probably would have had a stroke because of it.
I love the way you say a little bit of cancer that I had.
It was,
like it's a nothing. Like I had a cold and they discovered I had a brain tumor at the same time.
I had a cancer that if you're going to have a cancer, it was basal cell and it was manageable. And at the end of that treatment, the doctor said, we'll just see, that we got it all. And he said, I have good news for you. All the cancer's gone. I have bad news for you. There's a tumor in your brain. You better get looked at. And when the tumor was moderately successful being pulled out of my nose, the doctor said the chances of it regrowing from this little particle are about 1 in 5 million. And that's the lottery that I won. So the tumor did regrow.
You were one of the 1 in 5 million.
I was, yeah. It's really nice to be special. And when it regrew on the side of a different side, so they couldn't take it out through the brain, nose, and they had to give me a craniotomy in 2009.
A craniotomy is what?
Well, it's when they open up your brain like this and pull the skin back and go in and try to get the tumor out. And again, that's when it was not able to be operated on. They were able to take the brain, the blood clot out, but leave the tumor in. And from that point on, we waited. We waited to see if it would regrow. We waited to see how fast it would regrow. And only at the point that it regrew enough could we do radiation to at least cauterize the edges and hopefully contain it from regrowing.
A rather obvious question here, Judith, but at some point in all of this, did you think you were going to die?
Oh, of course.
You did.
All the way. I mean, you can't be given a diagnosis without immediately going to the worst case scenario. I mean, I wrote letters for my daughters for all the occasions that I would miss. I cleaned drawers so that the next wife wouldn't see that I was a slob.
That the what?
Well, I assumed I'd die, my husband would remarry, and I wanted things in order. But what was interesting is I decided, and I made a very clear decision, that I wasn't going to be one of those Victorian mothers who sat on a chaise and was poorly. I was not going to feel sorry for myself, and I was going to make this a narrative, part of my story, and take what energy I had to help people get through this difficult period.
At what point did the irony of all of this occur to you? Somebody who works in the healthcare system, being a patient in the healthcare system, and experiencing all of the worst that the healthcare system has to offer.
Well, to be honest, I also experienced all the best.
And the best, okay.
So I am a very grateful patient. I think we should be deeply grateful that we have the system that we have, and it needs improvement, but it is still a really good system. I got great care. What I found was the care itself was like solid bricks. We have excellent medical practitioners and clinicians and caregivers, but the mortar between those bricks is very uneven. So sometimes it's perfect, and other times it's cracked, it's open, it's a despairing situation. So I went from sitting around a table with executives and figuring out how we would measure success and give the best service and be the most economic and use technology. And we had all these metrics, and they were clear. When you put on the blue hospital gown, which is so much a democratic piece of clothing and very universal, you discover there's another metric, and that is treat me like a person, not a patient, not a bunch of cool symptoms, not a file number, not a process, but a real person who has a life before, after, and during being a patient.
Here's how Benedict Carey described it in the New York Times. He wrote, "It is practically a patient's birthright to complain about arrogant doctors, foul hospital food, and the sadistic night nurse. These are real problems at some places, and since at least the early 1980s, medical schools and hospitals have worked to solve them, giving doctors classes in bedside manner, and including patient representatives on staff, among other things. Yet the deeper psychological transformation from citizen to patient that occurs in almost any medical setting can be more jarring, and anthropologists say it begins immediately at admission. I want to better understand that what you just referred to, the putting blue robe on, where it doesn't matter how much money you're worth, you are still just another person with a blue robe on and your backside showing out there to the rest of the world. How dehumanizing did you find the whole thing?
I think it can be very dehumanizing. I think Christopher Hitchens called it as if you're a piece of sugar dissolving in water. You know, and I recall waiting for an MRI once and sitting in that waiting room and the attendant coming out and calling, brain tumor. And I went, whoa, you know, my name isn't even hard to say, and I had become the illness, not the person. I don't think it's deliberate, and I think with all of this, we'll go back and back to the point that it is about communications, that every single interaction with your healthcare providers counts. And it's time, and you can build a relationship there, or you can just be patient number 45.
Why do you think so many people in the healthcare system, as you point out, not out of any malice,
Oh no.
why do they look at you as patient number 45 instead of as Judith John?
I think they're under huge pressure. I mean, we know that there are too many patients in the system, there aren't enough facilities, there's not enough time. And if you're a specialist in particular, your goal is to see as many people as possible in the course of the day. We don't have those relationships as much as we need, like Dr. Welby. You know, when I grew up, that you sat and talked to him about your community and your mom and your dad, and he knew the whole person. And we don't have that in hospital settings. They are seeing a number of people for a number of situations. I felt like I was on a conveyor belt of specialists.
And yet, you know, I mean, I've seen you speak about this, and you called doctors and nurses on their bad behavior when you experienced it.
I did.
How did you have the chutzpah to do that?
I think because I know everybody goes into healthcare for the right reasons. I think that they don't need to be reminded that there are people here. So I was in a waiting room for 5 hours, and I know it's a waiting room. It's called that for a good reason, and I come prepared, and I'm a patient, but it was jarring how many people had no acknowledgement of the situation. And I thought if they only came out from behind the desk and said, we're running really late, we're really sorry, I know you've been here a long time, we'll see you as soon as possible, but nobody did that. And the room started to get more and more agitated with people and their families and their translators. And when I went in to finally get my appointment 5.5 hours later, I walked in, I sat in the examination chair, and the doctor walked in, never glanced up at me, and just said, okay, read the eye chart. And I said, whoa, let's start over. And I didn't yell at her like everyone else had been yelling all day. I said, can we just start over? We have to build a relationship. And she was taken aback and then said, I'm sorry. And we moved on from there.
So she acknowledged that the bedside manner wasn't exactly...
That's right. And I think it was the pressure of she'd had a terrible day, they were backed up, and she just wanted to get through another patient. I had a doctor looking at my MRI, and he was so enamored of the technology and the computer that I finally said to him, as I sat in the chair and he never glanced at me, I said, don't you want to see the packaging? I mean, and I think with a bit of humor, it's not screaming at people, it's acknowledging their situation as well. But people need to be acknowledged. The human interaction is the most important part of medicine to me.
Because you're there, vulnerable, in, you know, obviously a place where you don't want to be, and the last thing you want to be is further dehumanized, I guess.
I think so, and we're begging our doctors to cure us. And a lot of times they can't, but they can help the healing process. And that's going through the journey with you.
I want to show you this. Sheldon, number 12 here, if you wouldn't mind. Let's bring this photo up because this is a sign that you will see in most waiting rooms and or doctor's offices anywhere in the province of Ontario. And this is a sign that essentially says, you're on our property and you better behave yourself, and if you treat our doctors and nurses badly, you're in trouble. How's that for bedside manner?
Not so good. And probably next to that sign, because all hospitals have them, is we are patient and family centered. And it's rhetoric,
little mixed message
not
there.
reality. Yes, I was once in an emergency room, and it had the patient and family-centered sign, and then it had a big sign in bold letters saying, "You will wait." And I thought, whoa, that's a bit harsh. But I think I think there's a lot of work to turn the rhetoric into reality about what it means to be patient-centered and not just focused on process and procedure and numbers.
Here's what Kathy Torpy wrote in Patient Experience Journal. She's a New Zealand-based patient advocate. She had the following to say: customers, quote unquote, are generally well people who enjoy elevated status by virtue of their potential to purchase goods or services. Patients, on the other hand, are, by current definition, not well. Their status is greatly reduced by illness or injury that renders them vulnerable, frightened, often in pain, medicated, exhausted, and confused. In spite of these limiting factors, patients sometimes have to make important, often complex decisions in a short time frame. The goods they are purchasing are a return to health, and the services they seek often require an unspeakable level of trust in their service provider. It makes little sense to relate to patients as traditional customers in a business model that simply doesn't fit. Your take on that?
I think it's true. I think that the patient is sometimes discounted. And doctors in general are terrible listeners. I mean, they don't answer questions, they can get very brusque, or they are explainaholics. And they haven't realized that there's a whole lot to dealing with people that's about body language, that's about rapport. A patient is interrupted every 26 seconds by a doctor. That's been proven. And I think it's because they're so brusque and ready to go. I once asked a doctor about my craniotomy when I was being examined in a room with a lot of the students, and he was talking about a craniotomy, and like you, I said, well, what is a craniotomy? And he was actually annoyed that I interrupted the flow of his teaching. And he's done a craniotomy 1,000 times, and I'm glad of that. But he forgot, it's my brain, it's my first time, and it's my real fear. And that is the problem, is that you feel marginalized.
So when a doctor says to you, oh, don't worry about it, I do these all the time, I mean, do you want to hear that?
I think you want to hear it, well, tell me how it's going to work with me, because I appreciate that, I'm grateful for that, I'm glad you do the hard stuff like brain surgery, let's just concentrate on the soft stuff like dealing with me and explaining to me. And patients can be way better partners if they're treated with respect. They can actually follow orders better and be less repeat visits and actually be in a relationship which benefits both.
One of the things we hear constantly now is that healthcare, the people who are in charge of structuring our healthcare system say that they are patient-focused, that they want the whole system designed to put the patient at the center of everything. Yeah. Not the Deputy Minister of Health, not the Assistant Deputy Ministers, not the doctors, not the nurses, not the orderlies, not the dietitians, the patient. Yep. How true is that?
I think there are a lot of initiatives to try to make that happen. I think sometimes it's words and it will be individual by individual. It's very much nurse natural. You know, that's their training and their bedside manner, and they're with you more. You know, you can see your doctor from a distance, you can clinician, but I see organizations like University Health Network taking a huge step towards this. They've acknowledged the patient in their lanyards, for example, and it's the 4 A's. Acknowledge, ask, act, and ask again. I mean, that really says quite a lot. They've reorganized their staff so that the Vice President of Patient Relations reports right to the President of the hospital now. They actually continue the process in training across the organization, and you see it in a number of hospitals and a number of healthcare institutions, trying to get to what will ease the patient's burden and also ease their burden to give them better partners in their patients.
Okay, a couple of minutes left before we broaden out and have a bigger discussion with some other guests as well. Why were you never worried about stepping on the toes or correcting or reminding the people that you were dealing with, doctors and nurses, that you're a real person? Why were you not concerned that they wouldn't somehow seek retribution is too hard a way to put it.
Make you that patient.
Yes, yes.
I think because I understand and I believe every one of them has gone into healthcare to help people. I think the motivations are sincere. I think they're spectacular people. And I think they just get too pressed by administration or budget or timing to remember why they went into it in the first place. So what I always tried to do was do it with a bit of humor and a bit of understanding of their situation. It always goes back to what your mom and dad told you. Treat other people as you would like to be treated.
But the fear is, of course, that we won't get the good care that we expect and hope to get if we're too much in their faces.
I actually believe to my core that would never happen. I think if the fear is there, you don't want to be labeled, you don't want to be difficult, you want to be helpful, you want to be cooperative.
But they're too professional to actually do that.
They care deeply about their patients.
One last thing, how are you now?
I'm good. I'm good. We watch because it's inoperable. And my husband, I mean, as we were
So the tumor's still in there?
Oh yeah, it's my, Teddy tumor, I call it. It's there, and some days I'm more aware of it, I get head pain, but it's a small price to pay. Everybody has something. And as I was going through radiation, my husband was diagnosed with throat cancer. And I remember at that point my daughter saying, well, we'll postpone my wedding. And I said, no, you never postpone the joy. So we made it through my radiation, his radiation, and the wedding was spectacular.
It sure was. Look at that picture. You guys look fabulous.
Oh, it was fun. And nobody expected it to happen. So we were very lucky. I'm a grateful patient as well as a pushing one.
Grateful and pushy.
That's right.
It's a good combination.
Yeah.
Judith, thank you so much for coming in here and
My
having
pleasure.
the guts to tell your story.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.